Royal Freemasons has the pleasure of having Dr. Shibata with us, who is the inventor of Paro the Seal, something that Royal Freemasons has recently introduced to our dementia care program. Dr. Shibata has flown in from overseas. He's been attending numerous conferences demonstrating, I guess, the support and the care that Paro can provide to dementia residents in an aged care setting as well as in a home care setting. So welcome. Thank you very much for coming.
Thank you very much.
What inspired you to create Paro?
Yes, so I wanted to develop personal robot that can be used in our daily life. And I wondered what kind of robot can be accepted by people. And if we expect robot to work on some tasks, we have like dishwashers or like floor cleaning robot, something very specialized machines. So I thought I should develop something useless in terms of work.
Yes.
And I wondered what we have. And the pet animals are something like that. So we don't expect pet animals to work for us, but we love them and we appreciate them. And I wondered what is their role. And they can enrich our mind or our life psychologically.
Yeah.
And so I also investigated the research on animal therapy. So animals are very good for people, like from children to elderly people, and at the hospital, nursing homes, some other situations. And so animals are very good. So, but some people cannot accept animals, and also some places do not allow us to have animals. For example, some people have allergy, and some people are afraid bites and scratch. And also at hospitals or like nursing homes, it's very difficult to keep or manage animals there. So I thought I should develop animal type robot for the same use as like animal therapy.
And why not a cat and a dog? Why a seal?
So in our first imagination, I thought people may hold robot and while talking with others or while watching TV, or maybe put on the lap, or maybe next to the person and while stroking. At the time, I thought the robot should be like big rugby ball shape with very soft and very good texture. So I thought, what kind of animals have such kind of shape or characters? And the baby seal is very attractive for that purpose.
Yes.
Yeah, but of course, when we talk about pets, most people think of dogs or cats. And so I developed the seal robot as well as the cat robot and the dog robot.
Oh, you have?
Yes.
Okay.
And I asked many people to evaluate them. And in the case of dog or cat robots, people had high value in the beginning. But when they start to interact with them, they decrease the value because they compared the robot with image of real dog or real cat, and they are disappointed. And in the case of seal, people did not have like preconception, so they didn't have high expectation in the beginning. But it's through interaction with the seal robot, they increased the value. So I thought the seal robot is more acceptable by the people.
Our residents definitely love the seal. They do walk around and they do hold them and carry them, and they do like to sit and pat with them, so definitely wonderful. We have had a spill on one of the seals and we have cleaned the seal, so I can definitely support that it is a, a great design from a hygiene infection control perspective. What research and data do you have on Paro that's suggesting it's having a positive influence on dementia and aged care residents?
So basically, when people interact with Paro, or like people who have depression, anxiety, pain, and bad sleep, so they improve such kind of symptoms.
Yes.
And also interaction with Paro can reduce stress. And we measured hormones in the people of the urine of the people, and the data showed the interaction with Paro reduced the kind of stress. And also some people improve the kind of blood flow, blood pressure, and that's a kind of physiological benefit. And interaction with Paro encourage communication among the people and also connect new people. And so basically Paro has such kind of a good effect in general. But in the case of elderly people with dementia, some people have aggression, like hitting people, screaming, and also some people have wandering. And the interaction with Paro can suppress or reduce such kind of negative behaviors. And in the US, there is the University of Texas Tyler. So they had a randomized control trial with 60 people who have dementia. They found that the interaction with Paro can reduce usage of psychotropic medication for the anxiety 30%. And
that's significant.
Yeah, that's very significant. Yeah. And also the effect continues 2 hours more than the psychotropic medication. Yeah, so they have more findings, but they are now writing a kind of a research paper. Yeah. So when the paper is published, we can talk more.
Do you have any other robots in development or any other future plans?
So far, Paro has been used in different kind of situations, like dementia care, children with autism, cancer patients, some people who have psychological problems. And I'm trying to communicate with the users and collect data and also some opinions to improve Paro. And for example, we already developed Paro for like pet use. So Paro is like animal type. But in the case of dementia care, I got a kind of request that Paro should be very patient, because some people have aggression, and if they hit Paro, and if Paro respond in very negative way, that may excite the person to be more worse. Yeah, so Paro should respond in a kind of kind, patient way. Yeah, so there are some kind of different characters depending on the usage or depending on the purpose of therapy.
Okay.
Yeah, so now I'm trying to develop, like Paro A is for dementia. Paro B is for development of social skill for the children.
So they'll have a different personality.
Right.
Yes,
yeah.
different movements.
Depending on the purpose of therapy.
Yeah, that's wonderful. That's great. Well, thank you very much for visiting Royal Freemasons.
You're welcome. Thank you very much.
We and the residents are most appreciative of this little guy and what he's doing for our dementia program. We look forward to you visiting us again and learning of any other future developments, and we'll definitely look at supporting robotics in our dementia care and our care services across all of Royal Freemasons. So thank you very much for your time today.
And thank you very much.
Thank you.
What characteristics does she have that you can demonstrate to me?
Yes. So Paro has a lot of sensors inside. For example, whiskers are sensors, so Paro doesn't like being touched here. And also whole body is covered by tactile sensors. So if we use stroke Paro, Paro feels where and how I touch the body of Paro. And also being stroked is good for Paro, and being hit is bad for Paro. So Paro tried to be stroked by the owner.
Right.
Yeah. And so Paro gradually changed his characters to be liked by the owner through interaction with the owner. And the Paro has microphones for speech recognition and sound localization. So if you talk to Paro, Paro recognizes the direction where you are standing.
Right.
Yeah. And also Paro has a learning function of name as well as behaviors. So if you give new name to Paro, like John, and call it again and again, Paro gradually learns the name and start to respond to the name. And Paro's weight is about 2.5 kilogram. And I designed the weight, so it's like 5 pounds. And I designed the weight to be like the human's baby or like a pet.
Right.
Yeah. And when people hold Paro, a lot of people remind past memories of interacting with children, grandchildren, or like pets.
Right.
Yeah, and that is very good stimulation to the brain activity.
That's fantastic. And congratulations, I believe
Thank you
you got
very
an
much.
award for this. Eh? That's wonderful.
Yes.
Eh?
Yes. Yeah, Paro got many kind of awards. Yeah. So one of them is like Guinness World Record. That is, so Paro, they certified Paro as the most therapeutic robot in the world.